Team coverage continues tonight with this.
We are doing our best to prepare, but also knowing that we need to remain flexible.
Connecticut plans to be ready for whenever a COVID-19 vaccine is available. An advisory group for the governor held its first meeting earlier tonight.
Channel 3 Eyewitness News reporter SHAWNTE PASSMORE is live right now. SHAWNTE, the state apparently will need to unveil its plans pretty soon, right?
Well, Mark and Aaron, Connecticut is on a deadline right now. The CDC is requiring all states to submit their COVID-19 vaccine distribution plans by Friday, which is tomorrow. Mind you, nothing has been approved yet, but it already has people pretty split.
The race for a COVID-19 vaccine speeds ahead. While pharmaceutical companies conduct trials, Connecticut braces for the day one is approved. At its first virtual meeting, the governor's COVID-19 vaccine advisory group is pushing ahead with what it's calling a rough draft for a mass vaccination plan.
We are doing our best to prepare, but also knowing that we need to remain flexible.
The group focuses on three major points: allocation, which is who receives the vaccine first; science, when is it safe to distribute; and communication, which makes sure people are in the know when it comes to vaccine info. Eyewitness News wanted to get a pulse on whether people are ready to take a vaccine when approved.
I probably will take it when it's recommended for someone in my age group.
I don't like wearing a mask whatsoever, but I'd rather do that than take a vaccine.
But we've also heard people say they're leery of any developments.
I wouldn't take it because there's not enough information about it yet. So I wouldn't take it, and I wouldn't give it to my kids either.
Michael Urban, director of the Doctorate Occupational Therapy program at the University of New Haven, has also heard these claims.
The FDA is not going to let a drug just be, put through blindly. So there will be a lot of safeguards that are still going to be checked and monitored. A lot of the red tape, the paperwork, is what the FDA is sort of removing from the process.
Meanwhile, the state plans to break down distribution into phases, beginning with essential workers and those in the high-risk category.
And perhaps the biggest takeaway from tonight's meeting is this distribution plan is simply just a rough draft. The group does plan to meet throughout the end of the year. Live in Rocky Hill, SHAWNTE PASSMORE, Channel 3 Eyewitness News.